and I'm the founder and CEO of Family Center for Allergy and Asthma here in Rockville. So today I will be talking about the power of allergen immunotherapy and how it can help our patients and our community. Next slide, please. I have to tell you to move this one. Very good. So, this is a staggering statistic, which is that 60 million people in the United States are affected by allergic rhinitis. It may be you, it may be a family member, it may be a patient, but this is so common, right? We know about the nasal congestion, the rhinorrhea, sneezing, cough, postnasal drip, and it affects so many people. And right now, the majority of the treatment are things like over-the-counter antihistamines, nasal sprays, and eye drops. But I'm here to tell you about a kind of hidden, but not really well-known, but super helpful, effective therapy called allergen immunotherapy. Next. So what is this? It's actually commonly known as allergy shots. And how this works is that it's a disease-modifying treatment that actually changes how patients' immune systems react when they're encountering these allergens. And so what it entails is increasing amounts of allergen, and these are things like pollens, dust mite, mold, head dander, and then it reduces the patient's sensitivity over time. The indications for this are allergic rhinitis and conjunctivitis, which can be seasonal or perennial, allergic asthma, which can also be seasonal or perennial, and atopic patients with poor symptom control despite pharmacotherapy. So these are patients that we can consider who have atopic dermatitis or eczema that is unresponsive to standard therapy. On the right-hand side is actually my parents on Rockville Pike. What they're looking at and pointing at on the ground is this haze that I initially thought was dirt, but this was April of 2025, and that's actually pollen. So again, pollen are microscopic. You cannot see this with your eyes. It's under a microscope where we count them. And this shows you how visible it is for many of the people in the DMV who are affected by this for months on end. How does this work? It actually induces immune tolerance via a regulatory T-cell activation. It decreases the allergic antibody, what we call IgE, response, and it shifts it towards this IgG4 production. And it reduces the mast cell and basophil reactivity over time. How does this work? So, and how efficacious is it? So it reduces symptoms in properly selected patients 70 to 90% of the time. So it is a very effective therapy. What happens is that patients can reduce their medication use, so we can decrease the oral antihistamines, the nasal sprays, the eye drops. We actually can also prevent the development of new allergic sensitivities by treating the ones that the patient currently has. And this last point is a really important one, especially for our family practice and pediatrician colleagues, that it actually has shown to prevent the development of asthma in our pediatric patients with allergic rhinitis. So imagine that your nose is connected to your lungs, so I always tell patients it's one airway, so if we're helping to prevent the symptoms up here, it has been shown to decrease the risk of asthma development when they're older. What's the timeline of this? So this can be two phases, which we have a build-up phase that's anywhere from 3 to 6 months, and then after this is the maintenance phase, which is 3 to 5 years of therapy. And interestingly, patients do see clinical improvement anywhere from 6 to 12 months, but anecdotally in the clinic, patients will say even after a few weeks, they'll ask, oh, is it possible that I feel better already? And the answer is yes. So long-term benefits is, again, sustained symptom relief after therapy completion, and of course it modifies disease progression by the mechanisms we talked about, unlike pharmacotherapy, which really only treats symptoms. So picture all your patients who are suffering during pollen season or year-round. You take the medicine, it's good for 24 hours if you're lucky, but when you stop it, your symptoms come back. So again, it's a more long-term therapy. And so safety, this is generally well tolerated under an allergist supervision. Local reactions are common, so we have swelling and redness at the site, and systemic reactions luckily are very rare, less than 0.1% of injections, and we treat this with prompt epi administration and or an emergency protocol. So who do we refer and are great candidates for this? It's those patients who are poor responsive to standard therapies, again, the medications we talked about. those who prefer to avoid long-term therapy, and we have many of those patients who say, oh, I don't want to take medicines forever, I want more natural therapy. And again, this is purified extract, so it's as natural as it gets. And those whose quality of life has been impacted, right? We can't work, we can't sleep, we can't play our sports outside during the school year or this pollen season. So these are perfect patients who can be candidates for this therapy. So how can we work together? So for all of those who see these types of patients, recognizing these potential candidates for need, right? We don't want 10 years down the line to say, oh, I've been on an antihistamine for 10 years. Oh, well, we probably want to figure out what are you allergic to and potentially offer this life-changing therapy. Coordinate care plans with, again, our local board-certified allergy colleagues, and then we can monitor comorbid conditions together, such as asthma and eczema. So, in summary, allergen immunotherapy is a safe, effective, and underutilized tool for the long-term treatment of allergic conditions. Thank you so much.